challenges that everyone shares?
Right.
Is there anything that kind of stood out to you that you think is kind of a universal issue you're going to try to tackle?
So as the chair of the Healthcare Workforce Task Force, I've been traveling all around the state of Wisconsin, talking to different healthcare systems, trying to understand what their challenges are and if they have any innovative solutions that they're using to make sure that they can attract, retain the healthcare workforce here. And Essentia Health has a lot of great things that they're working on. And being able to cross-pollinate some of those ideas across the state, I think is going to be really interesting for the task force to be able to move forward.
Yeah, it sounded like you were talking about like apprenticeships and different things that worked in other places. So is that kind of fun to share those?
Yeah, absolutely. I was talking a little bit about UW Health in Madison and their apprenticeship model for nursing, where they're taking their certified nursing assistants and they're putting them through nursing school. They're paying them full-time wages, full-time benefits, paying for them to go to school, and they will be able to graduate with their registered nurse with no debt. And I think that that's really amazing to be able to invest in our community like this and to be able to really promote healthcare careers as an option.
There's been a lot of talk about rural hospitals.
Yes.
What can be done to help out them retaining, getting their workforce going too?
So one of the things that I've been hearing about from different rural hospitals is that if we can get the students into the hospital, we have such a fantastic culture here that they often stay. So making sure that schools are aware that they can do clinical placements within rural areas, being able to promote rural health as an area of focus, I think is going to be interesting. One of the other things that I want to make sure that I mention, particularly because it is important for rural health, is Medicaid expansion. Wisconsin is now one of only 10 states that has not expanded Medicaid across the nation, and we would be able to get over almost $2 billion over the biennium to be able to invest in health care in Wisconsin here. So it's one of the areas that I'm really hoping the legislature will look at in this next session.
I guess could you just talk a little bit about how important it is for you to make this tour of the different hospitals around the state? And I mean, you could easily email them and say, hey, what do you guys need? But you come here face to face with these workers.
Well, every time I go to a different hospital system or a different clinic, I learn something new. And I really like to be able to sit around the table to talk to folks. I'm a nurse myself. I've worked within healthcare systems, and I know only so much. And so being able to talk to all the different types of healthcare systems, whether it's rural healthcare systems, urban, on tribal lands, they all have unique needs, and to be able to bring that back to the healthcare task force is going to be really important for me.
Is there anything else you wanted to add about the state support? You mentioned the budget with the governor, maybe some legislative pieces that would be more challenging, but is there anything else that the state can do to help?
So we have really already had a really great investments into the healthcare workforce, but we can always do better. And so one of the areas that Governor Evers has put forth is to get more doctoral level nurses prepared within the state of Wisconsin. So being able to pay for those degrees if they stay in Wisconsin to teach. And so being able to expand upon that, that's been very successful, and moving forward, being able to make those recommendations for the governor, I think is going to be important.
When you go back to the Capitol, is there going to be one, I think Renee kind of hit on this, but is there going to be one specific thing that you're going to be like, hey, we need to get this thing rolling?
So one of the areas that we talked about is really looking regionally, how many spots are available within the educational systems that we have here in Wisconsin. Are we missing something? There are many different types of careers within healthcare. It's not just nursing, it's not just physicians. We need surgical techs, we need ultrasound techs, we need radiology technicians. Do we have the programs across the state to be able to build our own here, or do we need to look at that in a different way?
You were at Superior High School earlier today.
I was, yes.
What did you talk to the students about?
So what I talked to the students about there is the importance of voting. So I was in a civic class and I was in a government class, and what I talked to them about is that the age group that is least likely to vote are the one they were sitting in that room, which is 18 to 25. And so if they want to have a voice in what their future looks like, they need to register to vote, and they need to vote in every election.
Excellent. Where do you go from here? I heard Northwood Tech.
I'm going to Northwood Tech next, yep, and then Pattison State Park.
Wonderful.
Yeah.
What are you going to do at Northwood Tech?
I'm going to be touring them, looking at the programs that they have there, listening to maybe what some of their needs are, and what we can do administratively to be able to help.
What are you going to do at Paxton Park?
Oh, I think we're going to take a hike. We're taking a hike in Pattison State Park, yeah.
Getting ready for the fishing.
And I will be at the governor's fishing opener tomorrow. So a big bet with the governor that I will get a bigger fish than he has. We'll see. I lost last year, but hopefully this year, this is my year.
What did you bet him this year? Ice cream again?
He really likes an ice cream cone, so I feel like that's a good bet for the governor, yes. He's a big fan of ice cream.
Thank you very much.
Thank you.
What's his go-to flavor?
He's just a vanilla guy. Yeah, he's a